Which assistive device should you use after knee replacement? Welcome back, guys. My name is Dr. Mike, and I'm a physical therapist who treats patients right after knee replacement. And one of the most common questions that I get from my patients is, which device should I use after knee replacement? Now, many of my patients are so eager to getting back to their day-to-day activities and getting back to their regular function, whether that's returning to the gym or maybe participating in activities and hobbies that they used to. However, it's imperative to know that if you're not using the correct device, not only are you risking your chance for falling, but you're also risking the chance of having poor outcomes with this new knee. Now, the assistive device that you choose to use is very important because you want a device that's going to allow you to walk with the best quality gait, best quality walking. And that means you're not limping and you're not favoring one side, because if you do this and you start to rely on those bad movement patterns, you're going to realize how difficult it is to get back to your normal walking again. So I wanted to go over specifically a few different choices that you have, and hopefully after this video you have a little more information on which device is more appropriate for you. And at the end of the day, what's most important is that you are being seen by a physical therapist in person that can dictate and really tell you what is the most appropriate device for you. So starting off with the most common device, which I've seen and I think is the most appropriate for many people out there, and that is the front-wheeled walker. This is the walker that has two wheels in the front and the two platforms on the back. And this is a walker specifically is so helpful for people because it offers the most support when they're walking after surgery. Many patients will have some apprehensiveness and are very afraid and fearful to put some weight on that leg. You'll see people walking with leading with the surgery leg because they don't want to put full weight on it. However, this is why the front-wheeled walker can be the most supportive device and the safest, because it allows you to have that support when you're walking. And then as you're taking more steps and walking longer distances, you can definitely start to increase your stride and push the walker forward as needed. So as my number one choice for many of my patients, the front-wheeled walker is the safest and the most appropriate for many of the people that I see after this procedure. Now, the next assistive device that often gets brought up is the rollator walker. This is a walker that has four wheels and commonly will have a seat as well. Now, this can definitely be a viable option, especially if you're someone that gets out of breath really easily and you need to sit down quite often. However, one thing I would caution about this specific device is that it tends to make people walk faster than they have to. Having four wheels on the assistive device is going to allow you to move quicker and faster. And after a knee replacement, this might be difficult for you because you're going to want to slow down and really move at your own pace. This assistive device, the rollator, can be more of a viable option as you're starting to put more time on your feet, as you're starting to walk further, as you're starting to improve your walking quality. We're talking, guys, maybe 6-8 weeks down the road. This is definitely going to be something more appropriate for you because now it's still going to offer some good support, just like the front-wheeled walker. However, now it's going to require you to walk a little bit faster. Now, moving on to the next assistive device that many patients want to go to, and that's the single-point cane. The cane is just a device that many people want to go to right away because they think, if I can use a cane after surgery, that means I'm doing well, right? You have to be cautious when you're using the cane right after this procedure, because more than likely, at least given my experience and what I've seen, many people that use the cane too soon tend to develop a limp. And that is because the pain is still there and they are still fearful of putting full weight on that leg, which leads them to having a shorter step, a shorter stride, an unequal stride to where they're favoring their dominant side. So you have to be very careful if you are going to consider using the cane, because not only do you have to make sure that your walking quality is good, but you have to make sure you have enough strength and balance so that you're not falling over, because obviously this cane has less support. You're going from a two-wheeled or a four-wheeled walker, which has 4 points of contact on the ground, to now a single point cane, which only has one point of contact on the ground. So that's going to be a significant change on your balance, and you have to make sure that you have the right balance for this. Now, the last device that I would like to discuss is crutches. Now, the crutches are very rare to be using after a knee replacement, but I have seen a few of my patients use them, and it is appropriate. Once again, think about what your balance feels like. How confident are you putting full weight on the leg? Because now, just like the single point cane, you have 2 points of contact on the ground, which is both of the bottom of the crutches, which can significantly challenge your balance. So if you're anyone that is struggling to really feel comfortable putting full weight on the leg, I tend to see many people struggle with using the crutches because it really challenges their balance quite a bit. And they often do a lot better when they start on a front-wheeled walker or a rollator walker. Now that you have a little more insight on which device is most appropriate for you, it's going to be very important that you start to expose yourself to a graded and slow walking program. If you want to learn more on how to approach walking or how much you should be walking after this type of surgery with the device that you choose, make sure to take a look at this next video here.